Hello, my name is Dr. Rajiv Lochan. I am the lead consultant hepatobiliary and liver transplant surgeon here at Aster RV Hospital. I work with a large group of liver doctors, which is called the Integrated Liver Care Group in Aster. Numerous times, I see women or even men, executives, middle-aged, slightly elderly age group, who have been diagnosed with liver cirrhosis, and they come to my outpatients, and one of the first questions they ask me is that, doctor, I was a school teacher throughout my life. I never did anything wrong. I never smoked. I had very healthy habits. Why did I get liver disease? The other day there was a housewife who was asking me, doctor, I've never smoked or drunk in my entire life, but now you're telling me that I've got liver cirrhosis. Why has this happened to me? So this is a very, very, very common problem. People associate alcohol with liver cirrhosis. This is true in only around about 1/3 of patients. A large number of patients develop liver cirrhosis, which is not related to alcohol-induced liver disease. This is not to say that we should drink alcohol. This is very important. Alcohol can cause serious problems to the liver, and it should be avoided at all costs. But what I want to emphasize is that people can develop liver disease without the use of alcohol or with very moderate or minimum use of alcohol if they have other risk factors. What are those risk factors? These are two very, very important ones which I want to mention. The first one, which is very common, you all would have noticed, or you would know somebody who's got fatty liver disease identified. So you go to have a master health checkup, or you have a test for some other reason, and then there is fat picked up in the liver. And even people who are not overweight end up with having fat diagnosed in the liver. This is because in us South Indians, especially in South Asia, we are very prone to developing fat accumulation in the liver. This is a combination of things. This is because of our genetic makeup. A lot of us develop diabetes at a young age. At a young age, we develop high cholesterol. We have a diet which is very high in carbohydrate. And the most important thing is our level of exercise is very, very, very low. So all this leads to fatty liver disease or non-alcohol related fatty liver disease. And along with that, even a very moderate amount of alcohol consumption can lead to an additive or exponential problem which leads to cirrhosis. So fatty liver disease or accumulating fat in the liver is a very, very big cause of cirrhosis. And I'm sure a lot of you will be surprised to know 1/3 of patients transplanted by us are transplanted because of fatty liver disease related cirrhosis. The other important cause of liver cirrhosis is hepatitis B and hepatitis C. These are virus infections of the liver which can cause cirrhosis of the liver, and unfortunately, if not identified by preemptive, by which I mean screening or master health checkup or some other type of test, they are not diagnosed. And generally, when hepatitis B and hepatitis C cause problems, cause symptoms, which is jaundice or fluid in the tummy or some types of growth in the liver, this means that these viruses have been there for a very, very long period of time. Even these viruses can cause cirrhosis, and they also form a large chunk of patients who end up having to come to see a liver doctor. The other small group of patients is children with liver illnesses, and they have a very wide type of illnesses, like for example the bile ducts not growing, which is called biliary atresia, or Wilson's disease. Wilson's disease is a very eminently curable disease, and they also can have autoimmune related disease. And then there are lots and lots of various and varied types of genetic diseases which I want to go into detail. And so children's liver illnesses form around about 10%. So 1/3 of illnesses are because of alcohol, another third is because of fatty liver disease, and another third is because of viral related illnesses. And the most important thing, even if you have any one of these risk factors, to try and keep the liver healthy is to do exercise. 4 times a week exercise, which will help to keep your liver healthy. Maybe we'll talk about that at a later time.